Natalie, welcome.
Thank you. Thanks for having me, Michael.
Thanks for joining us in this series we're doing on market shaping. And we absolutely had to have you as a critical player. So you founded the Volume Guarantee Program at what was then the Bill and Melinda Gates Foundation 15 years ago. And during that time, you've done 27 guarantees.
Correct.
Saving over $1 billion
Correct.
for donors and public procurers buying healthcare equipment.
Yes.
That's an amazing achievement. Congratulations.
Thank you. It's amazing to reflect on. Yeah.
So can I ask you to start off by telling us, how did you get into this? What was your first encounter with the idea and your first engagement with it?
So I'm a recovering consultant from McKinsey. So when I joined the foundation, I actually joined in our FP&A group and actually got financial planning and analysis. And I was supporting the team that funds Gavi, the Alliance for Vaccines and Immunizations. And at the time, Bill asked, why are they so much in the hole? And it's very easy because donor governments give on a one-time basis. So your revenues come in every year, but kids, the same amount approximately, are born every year and they need their shots. So you have these recurring revenues. And so you can't ever balance the books when you have one-time revenues and 5 years of expenses. And so I went through my little consulting analysis of ways that we could help Gavi. There's just a few levers. You can raise more money, which we were trying to do. You could vaccinate less kids. Totally unacceptable. Give them less vaccines or give less kids vaccines. The third lever was price, which is how much does Gavi pay for the vaccines it gives to kids. And so that's the one thing that when we first started focusing on, what can we do with price? And one of the first projects I worked on was the rotavirus vaccine, which was introduced as part of the 2011 Gavi replenishment. And in that, you learn a lot about the global health ecosystem in that it's incredibly fragmented and it makes it very expensive to deliver vaccines to the poorest countries. So my first encounter was on pentavalent vaccine for Gavi. Now, pentavalent covers the 5 kind of top killers, if you will, of children in poor countries. And it's the most cost-effective vaccine across the board. And I know this because when we were trying to fundraise for Gavi, Bill asked us which kid is going to die. If you can't raise enough more money, you can't get the prices down, you can only reduce the number of kids you vaccinate. And so the logical outcome of that is that kids die. And so that puts a pressure and a focus on what we're trying to do. So the global health ecosystem, so donors, UK government, the US government, all the large donors pledge, and they give money once a year or so. Gavi has to go buy vaccines. A vaccine maker has to build a whole facility and commit to that upfront and make the vaccine. Now, if the company doesn't know whether Gavi has money to buy it, whether the countries are going to adopt the vaccine, and whether UNICEF is actually going to buy from them, it makes it very hard for them to make that investment. So that's a lot of risk. That risk translates into prices for Gavi. When they go out and ask for a pharmaceutical company to give a bid on the vaccine, the company looks around, sees how much extra capacity they have, and says, sure, we'll sell it to you at a market, whatever the current market price is. If instead we could go to the pharmaceutical companies and say, hey, when you build your facility, build some for us. And we're going to guarantee that you'll be able to sell that product. And we'll be able to tell you how much and tell us all the other ways that it's expensive. Is a 1-dose vial expensive? Maybe we could put it in a 10-dose vial. So it's actually the recovering consultant part. That's how we approach volume guarantee negotiations with companies, is to take cost out so you can reduce the price, so that the Gavi and other procurers can have the lowest cost, lowest price product in the market. And that's all a volume guarantee is certainty for the companies to do business and figuring out all the different ways that there's potential extra costs in the system and removing those.
So that's a great story. So you found ways of talking to manufacturers.
Yeah.
saying we're going to guarantee sales over a period of time.
Yeah.
And in return for that, we'd like to see the price come down.
Yes.
And they can do that because their costs go down.
Yes. One of the concerns about doing a volume guarantee is really, are you destabilizing the market? Are you favoring one supplier? We always want at least 2 to 3 suppliers in a market. So we're not trying to serve the entire demand with one company. It's a very vulnerable position to put kids in who are relying on a company. You know, what if the company has some sort of technical problem? And so we will at the same time be working with 2 or 3 manufacturers, or at least understanding the landscape enough to know that there's actually already 2 manufacturers in the market. They have enough capacity. And so we can do this one deal. We will have, you know, enough secure base capacity, and we can buy more from the other companies.
Okay, so that's a really important point to me. It's you're not just thinking about reducing the price. You're thinking about what does the whole market look like.
Correct.
And you don't want to use your funds in a way which is going to promote just one manufacturer having a monopoly.
Yes.
You want to make sure there are a few suppliers in the market. So you need to think about that when you're negotiating with the manufacturer you're talking to, who started with.
Yeah, and it's a short-term and a long-term concern. So the short-term is, of course, if that one company had a manufacturing problem, you wouldn't have product. But in the long term, we don't want to do volume guarantees forever. So you do want 3 suppliers in the market who will then respond to this one volume guaranteed price so that you can sustain that price with the demand that we've created in the long term once the volume guarantee has ended. So in the short term, yeah, it's supply security, and in the long term, it's price certainty.
So that's really interesting. So the real aim you're after is the long-term viability of the market.
Yes.
And so if I understand you correctly, you're looking for bringing down the price in a way that is sustainable, but it lasts a long time.
Yeah. I mean, I think the best way to understand what volume guarantees can do is really, it's supposed to break the chicken and the egg conundrum, right? Because when a new product comes out or a product is at a high price, it's at a low volume. Like Gavi can only buy a certain number of doses with a fixed budget if the price is high. And companies can only get economies of scale if they can have higher volumes, but they can't have higher volumes until the price is lower. So by putting in a guarantee that says we're going to guarantee you the volume you need to get to the low price, the manufacturer can then upfront offer the low price. That generates demand, and that demand then is what sustains the kind of price and volume going forward, if that makes sense.
So you talking to a manufacturer, they've got a high price,
Yes.
low volume. You say we'll give you a guarantee, and then you flip them around. So you've got a higher volume and a lower price.
Yes.
That's your aim.
Correct. Like, you know, on the new bed nets, and this is a pretty regular problem in new product introduction. And like we worked on our 2nd generation BASF Interceptor G2 bed nets. It's an amazing product. You know, it was field tested, it was pre-qualified and approved, but it wasn't adopted because it's more expensive than the old product. And the company at the time, BASF, couldn't offer a lower price because they were not selling enough to really optimize their manufacturing capacity. So with the guarantees that we did, we were able to first launch the product to kind of prove that it was much more cost effective and also saved more lives in terms of reducing malaria burden. But then that allowed the company to actually scale up manufacturing, increase capacity, also, you know, move it to different areas of the world where they could lower the costs because they had the certainty from us that once they did that, they would be able to recover their investments and utilize all of that capacity.
So Natalie, you talked about starting with vaccines, but you just mentioned BASF mosquito nets. What are the other products that you worked on these years?
We started with mostly vaccines for a very simple reason. It's a very consolidated market. Gavi is the one source that we can go to for demand numbers, so we can easily match it up with what companies need. UNICEF is the one procure, and Gavi consolidates all of the donor funding and then works obviously with the countries to introduce it. So it was a very neat market for us to start piloting this kind of investment tool into. And we did everything from rotavirus, which was the very first deal we did, to pentavalent vaccine. So we've done it on IPV, which is an activated polio virus, and trying to introduce that when the WHO recommendation came out for all kids to start at least with 1 dose, and that was in 2014. And then we also have done deals on HPV, which is the human papilloma virus. It's the main cause of cervical cancer. Everywhere this vaccine has been introduced, I think it was approved in 2006 and introduced in 2007, cervical cancer is basically eliminated for the cohorts of women who have, girls who have received the vaccine. So it's an incredible intervention. So we started with the vaccines because it was the easiest thing. We could easily match demand and supply. Then we went to family planning. I don't know if you remember, but in 2012, there was the UN Commission on New and Underutilized Commodities. One of those commodities was contraceptive implants, which have been around in the US for decades, but was not used in the lower income markets because the price was so high up front, $18.50. We were able to negotiate and get that price down to $8.50. And basically that allowed us to serve over 50 million women while saving $500 million on procurement. So we did family planning. We've done things with a self-injectable contraceptive called DMPASC. It's cyanopress, manufactured by Pfizer. And then we moved to HIV. And that is an area that is also kind of like the vaccines market, very well organized, a few large buyers, and it was for a new regimen of antiretroviral therapies, ARVs, that combined 3 different drugs: tenofovir, lamivudine, and the newest one, which is dolutegravir. And at the time that we did this introduction, which I think was in 2017, it was actually superior to the regimens that were available in developed markets because you had to bring together products from 3 different companies that didn't work together in high-income markets, but were able to donate and give access to lower-income countries in a combination that was highly effective. And that took the price down for AIDS patients to $75 per patient per year. And now just the last couple of years has gone all the way down to $45 per patient per year. And it's an incredible regimen with a very safe resistance profile. It's easier for women, for patients to use. So then we moved into malaria. And we started with bed nets. And that's
together.
which is the deal that we did together. And that was one of the harder deals we had to do. Most of the time, like on our ARV deal, we were able to actually find ways to bring the cost down from the current standard of care. So when we introduced the dolutegravir regimen, it was cheaper than what was being spent. Bed nets, the new generation of bed nets, cost more because it had an extra insecticide into it. So there's no way you can make it cheaper than the existing bed net with 1 insecticide on it. And so for us, it was really like, how do we work with this market and introduce a new product at scale when it costs more? Because donor funding, country budgets are always tight. And I think working with the innovator manufacturer BSF, but also with a consortium. And that's, as you know, the other secret to our volume guarantees is how we work with all of the partners in the ecosystem, from donor governments to implementing organizations, to demonstrate that the new bed nets were actually much more cost effective. So even if on a upfront basis the net costs more, between the lives saved, how much longer it lasted, the reduction in malaria cases was actually a better deal on a cost effectiveness metric. And that was, I think, what our deal really unlocked the studies that allowed BASF to do that, but also to get them down the manufacturing curve in terms of scale. They, I think, scaled up 3 or 4 times during our volume guarantee period, and the demand has been incredible. I think in last year, 2024, WHO recommended this new generation bed net in March, and by August, the order supported by Global Fund and the President's Malaria Initiative, which is a part of USAID, countries adopted it. Over 50% of the countries buying bed nets have adopted the new bed net over the old bed net, and that's an incredible rate of adoption for a new product. I mean, from recommendation to uptake, it's an incredible success story.
And then you went on to do COVID?
I did a lot of COVID deals.
What did you do in COVID?
We did everything. We started off with PPE, which is, what is PPE?
Protective personal equipment.
Yeah, protective personal equipment. So we started with protective personal equipment, or PPE, which was in shortage at the time. And to do that, we actually just gave, working capital to UNICEF and WHO to secure those agreements. Then we went into diagnostics, and we did 2 guarantees to get the rapid test for COVID, which was becoming broadly available in high-income markets, but to basically guarantee capacity at 2 different companies, Abbott and SD Biosensor, so that we could get the test for $5 for the lowest income countries. We did therapeutics. We did a lot of money at risk on therapeutics. One of them was molnupiravir, and then, when the science said that that was not as effective, it was okay, but we had reserved capacity to make it available. And that's, those are the kinds of risks that a volume guarantee can take in terms of reserving capacity at companies on behalf of the poorest countries who, unlike high-income countries, can't go place an order right up front and say, hold those for me. And then we also did a vaccine deal with the Serum Institute of India for their COVID vaccine. And that one, I think, it ended up being incredibly useful in terms of having doses ready for the India market. And I think we were less successful in getting it out to the rest of sub-Saharan Africa or many of the other countries, only because the need in India was so high.
Great. And now you're still doing new volume guarantees, new kinds of guarantees, and new products, some of which are in the pipeline. We're not going to talk about. So that's a big range of products.
Yes.
That's a lot of different medical expertise to bring to different products. But in all of them, you've used financing as a way to make products available and reduce the price along the way. So while you're doing that, is this a kind of role in which you lose a lot of money? I mean, you're offering guarantees. You said you've saved over $1 billion on procurement costs.
Yeah.
Does this mean that the Gates Foundation had seen a lot of money going out the door to pay off on the guarantees?
Surprisingly, we have not historically. And I will say that the last 15 years has been an incredibly generous period from the large donor countries, where Gavi's met its replenishment goals, Global Fund has met its replenishment goals. And so for most of our we've had calls on 3 different guarantees, and that is only around $100 million on over $1.5 billion of guarantee dollars that we've actually put to use. So pretty low rate. Again, back to the historical generosity of all of the donor governments. And it's nice to go back and say, what we're doing is helping them, those generous dollars, be spent as cost effectively as possible by buying more product at lower prices. Going forward, it's a challenging environment for both, donor governments and, the national governments who are buying on their own. Everyone has budget pressure. I would say that doing these types of deals is actually even more important, because now every dollar counts way more, but it's riskier, right? Because we don't know how all the replenishments will come out. We don't know if countries will be able to come up with their own dollars to buy the products. But I would still say it's important. And I'm super grateful, at the Gates Foundation. We have a pretty big risk appetite, just like in COVID, where we were able to take risk on behalf of the poorest countries. We can still do that now if we feel an intervention is incredibly important. It's where, Bill and the board and Mark have been always willing to kind of put the dollars at risk to make sure that that product is available to the poorest countries.
That's terrific. So I think you said the total value of your guarantees you've done is about $1.7 billion.
Yes.
So
Yes.
you've lost about $100 million
Yeah.
paying out during that time. It's a pretty good ratio.
Yeah.
It's not a way to make money.
It's not. There's no way to make money. You can only lose money on these deals. But I think, the other thing you should think about is when you lose money on a volume guarantee, you basically have the option to always buy the product and donate it. And buying a bed net or buying a vaccine and donating it is not the worst use of charitable dollars. I mean, it's the actual use of charitable, intended use of charitable dollars. So I think that's how, I've been incredibly lucky, to be at the Gates Foundation, where the leadership has kind of understood that that's what we're doing with this program, is making the best use of donor dollars where we have them, and just ensuring that the product we have enough capacity. And that's actually the thing we haven't actually really touched on, is the other aspect of volume guarantees is getting access to capacity. We've talked about reducing prices a lot so we can buy more. But sometimes, just like in COVID, the pharmaceutical companies don't make the upfront investment in capacity to be available for the poorest countries because they don't know if the demand will be there. They don't know if the money will be there. And so the other half of what we're negotiating for in volume guarantees is always the volume, like make sure that we have access to this amount for our countries.
So you're looking to reduce prices, get more volume out. You're looking to have multiple suppliers in the market, but you're also trying to ensure there's enough capacity.
Yeah.
Okay, that's terrific. So you mentioned earlier that these transactions involve lots of partners. I think with the mosquito bed nets, you involved the Innovative Vector Control Consortium, the Global Fund, Unitaid, WHO, Imperial College was doing some modeling on the impact of making it work. You had randomized controlled trials going on in 2 countries. So lots of pieces at once. How do you find the process of bringing that many stakeholders together? I mean, on one hand, you've got manufacturers who are really thinking hard about how do we make the economics of this work? So in the end, manufacturers have to turn a profit.
Yes, exactly.
And on the other hand, you've got WHO, who's only concerned about what are the global health impacts.
Yeah.
How do you bridge those communities?
It is, it's a skill that I've really had to develop. I think I came from private sector. I was always doing banking and consulting and understood from the private sector lens what needed to be solved. But that actually then really helped me bridge to explain. One good example is contraceptive implants. So we had the UK government, we had the US government, we had UNFPA on one side, along with a bunch of the implementing partners. And then we had the 2 companies, Merck and Bayer, on the other side. So when Merck and Bayer say, hey, can we do a 5-pack that's standardized across...
What's a 5-pack?
This was for our contraceptive implants deal.
Contraceptive implant is something that goes in the upper arm.
Yeah, in the upper arm, and it provides 3 to 5 years of protection for the woman.
Right. So,
and in high-income countries, it's sold as one little box, and in the box is everything you need to deliver the implant. In the lower income, when you're trying to reduce price, if they can put 5 of these in one box, it does a couple of things. It reduces the cost because you don't have 5 boxes. You're not creating waste on 5 boxes, and you're actually increasing capacity. So if you imagine a manufacturing line where you have to manufacture individual boxes versus dumping 5 in a box and folding it together, you've actually increased the capacity of your packaging line, not quite by 5-fold, but like by quite a lot. And so when the companies came and asked both the US, who was buying the implants, as well as UNFPA, can we have a standard box that has 5 of these implants in it for you and sell the same one to both of you? I think there was a lot of, why would they do that? Like, we need this, we need it in 3 languages. But I think translating it back to, hey, we were trying to ask for the lowest cost. We want this to be sustainable. Here's how, just the way I explained to you, here's how it actually lowers the cost, which lowers your price, which also increases the capacity you have access to. That translating the what does it mean in terms of business to what does it mean in terms of impact, that's the role that I play. And sometimes it's hard, but and then going back the other way, which is like, why do we need technical training? You know, like, why is it important to give us lead time to make sure we're training healthcare workers? Bringing that back to the suppliers, it feels a little bit of being the bridge. It's challenging, but I think the consulting mindset of like, I need to be able to understand why are people asking for the thing they're asking for so I can translate it to the other party, is one of the important things I've learned, and has also, I think, been pretty helpful in terms of problem solving through these volume guarantee agreements.
Can I ask you, there are a number of criticisms that are sometimes made of volume guarantees, and we ask you about a number of them in turn. So the first one is you're just partnering with the manufacturer and creating monopoly for them. You're giving them a financial advantage. They will dominate the market hereafter. How do you answer that?
I think what is helpful to understand is a volume guarantee investment is often one component of a whole investment plan that I am working on with the program teams that I'm working with on the foundation. So I might be doing a volume guarantee to the company like BASF that has the first product out to market, but we also might be working with the next one that we expect to come out to market, and we might give them a guarantee or we might give them a grant. We're also funding on the other side technical assistance. And so, like we talked about earlier, we're often solving for both the long term and the short term. The volume guarantee in the short term oftentimes means creating sometimes a limited term monopoly. And that's the trade-off to that is if you wait for 2 or 3 suppliers in the market, then all of the patients in our countries have to wait till there's 2 or 3 suppliers ready to go before they can get access to this product. So it's a trade-off between access and a limited term monopoly. And then we mitigate against that limited term monopoly by working with other suppliers in the market to ensure they also have global access so we can get enough capacity, we can sustain the price for our key geographies.
You said early aiming to have 2 or 3 suppliers in the market,
Yeah.
always, and that's always an aim, and you're thinking, oh, what do we need to do to help promote that?
Yeah.
Okay, that's great. And with another criticism that's closely related, I sometimes hear about volume guarantees, is well, you're locking in the price as a floor price.
Yeah, a ceiling price.
No, so you call it a ceiling price, because I understand it. The volume guarantee you give is for a ceiling price. And you say to the manufacturer, here's the maximum amount you can charge per unit for this. That's the ceiling price. But the criticism that's often made is that ceiling price actually operates as a floor price, and it'll never come down. What's your experience with that?
One good experience is on our dolutegravir volume guarantee. That's the new antiretroviral therapy that we introduced. We set a ceiling price, or we set a price with the 2 manufacturers that we negotiated volume guarantees with. And that is one instance where we actually did 2 deals at the same time to ensure supply security for introducing a product as critical as an HIV medication. But we actually knew all in the market that there was actually 6 other suppliers in the regulatory process that were coming to market over the course of the guarantee period, and that once they entered, they would compete on the price. And it came down from $75 in 2017 to $45, and it actually almost immediately dropped the price. The other one is in a case like our very first guarantee with Biological E for hexavalent product. We actually asked...
Pentavalent.
Yeah, sorry. Yeah. Pentavalent product. And when we asked them to enter, we had 1 company that was leaving and 3 others that actually had been put on hold by the WHO. And so we were actually in a supply crunch. But we actually provided technical assistance to all of those other suppliers so they could get their quality up. When they came back in, they all competed the price down from our guarantee price to something like 85 cents. And that created a call on our guarantee, which we were actually quite happy to pay because that meant that Gavi and all the procurers were generating huge savings on the entire market because the product had gone down.
You did a volume guarantee with one company,
Yeah.
Discuss Biologically,
Yeah.
but you kept supporting the other companies as well.
Yes.
They were able to produce it more cheaply, and therefore they undercut the sales from the first company you were supporting. But you're happy to pay out because you just want to get the product out.
We got the product out in the short term because we solved the supply problem when all these other companies had to leave. But then we also, on the long term, wanted to make sure that we had a competitive market. And that competitive market will settle wherever, the price still makes sense for the companies to supply.
That's a great
So
story.
it was 7 suppliers that eventually came in. On dolutegravir, they actually eventually had 19 suppliers or something like that under the Unitaid Medicines patent pool.
So this goes back to your point earlier about you're kind of shaping entire markets. It's
Yeah.
not just the individual
Yeah.
manufacturer at the time, but you're also making it work commercially for that manufacturer.
That is the goal.
Which brings me to my third criticism that's sometimes made of volume guarantees, which is there you are as a foundation, one of the most powerful organizations in the world, and you go in and you negotiate secretly with manufacturers on a particular price, and you agree what the ceiling price is going to be.
Yeah.
In conversations which are not transparent, nobody else gets to see inside.
Yeah.
Where's the accountability for that? Why is it that we should trust you to be doing that, or MedAccess, us doing it?
Yeah.
Rather, shouldn't you just make the entire thing transparent so everyone can see?
I think what's hard is what we're asking companies to do is share very confidential information, basically their costs. And so what we can do is we often consult with all of our partners. Before we did dolutegravir, we said, what would be a reasonable price that could help you adopt this product? We have to go back and triangulate that with the companies. I understand that criticism. I think in the absence of being able to provide some of that confidentiality to the companies, it's hard to do the problem-solving piece, to understand here's where their costs are, and so we can help solve this piece of it. But there is a degree of trust. I would also say there's a little bit of incentive alignment. We are one of the donors to many of the institutions that are buying. We're not the sole donor, but some of our money is also buying it. So our incentive is aligned to create the lowest priced that we can get that we think is good for the market.
Because you want to save money.
Yes, we're trying to save money.
So let me wrap up with a general reflecting on all of this. 27 guarantees, over $1 billion saved, but more than that, the broader market.
Yeah.
$2 billion is just kind of the immediate direct.
Yeah.
But at 1.7 billion
Deployed.
exposed during this time. So reflecting back on that, more than 15 years of doing that, what are the main lessons? What are the things you would pass on to someone who wants to get involved in this kind of activity? What have you learned?
Again, I go back to think about it as a long-term business development partnership. You have to go in partnership with the company to understand what is preventing them from serving your market in a way that the market can buy from them. And working with all the ecosystem on the global health side, understanding what are some of the challenges. Sometimes it's not just the product that is getting, can we get the product at a reasonable price? We need training dollars. We need the planning on the supply chain piece of it. We need investments on the supply chain piece. So it takes more of a partnership mentality than an us versus them negotiation where it's zero sum. I want a lower, price from you, and that just takes away from your profit. I think that kind of mentality helps you problem solve because there's so many problems. It's, getting to the price and the volume is the first step, as you know, of any volume guarantee agreement. Getting the product to the patient is a lot of steps in between. And that's actually where you get your impact. Not getting a lower price, not being able to just buy the product. And so it takes a lot of collaboration and a mentality of how can we solve this problem together and not in a zero-sum way.
That's a great lesson. So Natalie, I take away from that, reflecting on this, two things really stand out from what you've said. One was what you said right at the start, was it's all about the kids.
Yes.
Getting the vaccinations.
Yes.
And it's all about the core problem is how do we achieve that?
Yeah.
And the second thing that really stands out for me is what you brought to it was the analytical mindset you brought from McKinsey. And it sounds to me like you've just kept deploying that over and over and over again. So there's a constant problem-solving mentality.
It's my own personal reward. I love problem solving. It's like, here's a challenge. How do I unwrap it?
And
Yeah.
you get pleasure from that.
Very much enjoy that process because the reward at the end is the kid gets the vaccine. I mean, what other motivation could you ask for?
That's great. That's inspiring. Natalie Revelle, thank you so much for giving us time today and explaining the story.
Thanks for having me, Michael.
Thank you.